CEN exam prep how long? Question 1. A patient presents with a patellar dislocation. The nurse should monitor for associated injury to the Option A, femoral artery. Option B, sciatic nerve. Option C, popliteal artery. Option D, tibial nerve. The correct answer is option C, popliteal artery. Patellar dislocation can cause injury to the popliteal artery, which lies behind the knee joint. The nurse should assess distal pulses and capillary refill. Femoral artery, A, is more proximal. Sciatic nerve, B, is more posterior. Tibial nerve, D, is also in the popliteal area, but the popliteal artery is the most critical vascular structure. Question 2. During a disaster drill, which patient should be prioritized for evacuation? Option A, patient with a fractured femur who is stable. Option B, patient on a ventilator. Option C, patient with a minor head laceration. Option D, patient with a sprained ankle. The correct answer is option B, patient on a ventilator. In a disaster evacuation, patients who are ventilator- dependent are the highest priority due to their reliance on life-sustaining equipment and difficulty in moving them. Stable fracture patients, A, and minor injuries, C, D, can wait. Question 3. Which of the following is the earliest sign of cardiac tamponade? Option A, muffled heart sounds. Option B, JVD. Option C, pulsus paradocus. Option D, hypotension. The correct answer is option A, muffled heart sounds. The classic Beck's triad includes muffled heart sounds, JVD, and hypotension. Muffled heart sounds are often the earliest sign because fluid accumulating in the pericardial space dampens the audible heart sounds. JVD, B, occurs as right heart filling is impaired. Pulsus paradocus, C, is a later finding. Hypotension, D, is a late sign indicating severe hemodynamic compromise. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient is diagnosed with acute appendicitis. The nurse is particularly concerned if the patient reports which symptom? Option A, sudden relief of pain. Option B, nausea and vomiting. Option C, right lower quadrant pain. Option D, rebound tenderness. The correct answer is option A, sudden relief of pain. Sudden relief of pain in a patient with suspected appendicitis may indicate perforation of the appendix. This is a serious complication requiring immediate surgical intervention. Nausea and vomiting, B, right lower quadrant pain, C, and rebound tenderness, D, are all expected findings in appendicitis. Question 5. A patient with opioid use disorder presents with suspected opioid overdose. Which medication should the nurse anticipate administering? Option A, naloxone. Option B, flumazenil. Option C, naltrexone. Option D, methadone. The correct answer is option A, naloxone. Naloxone, Narcan, is a pure opioid antagonist that reverses the respiratory depression and sedation of opioid overdose. Flumazenil, B, is for benzodiazepine reversal. Naltrexone, C, is for maintenance therapy. Methadone, D, is a long-acting opioid. Question 6. A patient presents with a severe allergic reaction with difficulty breathing and hypotension. What is the priority medication? Option A, diphenhydramine. Option B, epinephrine. Option C, albuterol. Option D, hydrocortisone. The correct answer is option B, epinephrine. Anaphylaxis is a life-threatening emergency requiring immediate epinephrine. Epinephrine is the first-line treatment for anaphylaxis with respiratory or cardiovascular compromise. Diphenhydramine, A, albuterol, C, and hydrocortisone, D, are all used but are secondary to epinephrine. Question 7. A patient presents with tachycardia, palpitations, and weight loss. What endocrine disorder is most likely? Option A, hyperthyroidism. Option B, hypothyroidism. Option C, diabetes mellitus. Option D, Cushing's syndrome. The correct answer is option A. Hyperthyroidism. Hyperthyroidism presents with tachycardia, palpitations, weight loss, anxiety, and heat intolerance. Hypothyroidism, B, presents with bradycardia, weight gain, and cold intolerance. Diabetes, C, presents with polyuria, polydipsia, and polyphagia. Cushing's syndrome, D, presents with weight gain, moon phases, and hypertension. Question 8. In triaging a patient with abdominal pain and a fever of 102 degrees Fahrenheit, the nurse should assign which triage category based on the Emergency Severity Index, ESI. Option A, ESI 1. Option B, ESI 2. Option C, ESI 3. Option D, ESI 4. The correct answer is option B, ESI 2. ESI 2 is for high-risk patients who are not in immediate danger but require rapid assessment and treatment. A patient with fever, 102 degrees Fahrenheit, and abdominal pain meets criteria for ESI 2, high-risk. ESI 1A is for life-threatening conditions requiring immediate intervention. ESI 3C is for stable patients requiring 1-2 resources. ESI 4D is for stable patients requiring no resources. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A patient with severe asthma exacerbation has a peak expiratory flow rate, PEFR, of 35% of personal best. Which treatment should the nurse anticipate? Option A, continuous nebulized albuterol. Option B, oral corticosteroids. Option C, 4-magnesium sulfate. Option D, immediate intubation. The correct answer is option A, continuous nebulized albuterol. PEFR below 50% indicates a severe exacerbation requiring aggressive bronchodilation. Continuous nebulized albuterol is indicated for severe asthma. Oral corticosteroids, B, should also be given but are not the immediate treatment. 4-magnesium, C, may be used for refractory cases. Intubation, D, is for impending respiratory failure with altered mental status, exhaustion, or hypercapnia. Question 10. A patient with a history of DVT presents with sudden onset of chest pain and dyspnea. What is the priority nursing action? Option A, administer oxygen. Option B, obtain a 12-lead ECG. Option C, prepare for CT angiography. Option D, administer heparin. The correct answer is option A, administer oxygen. The ABCs are the priority. Administering oxygen to treat hypoxemia is the first step. ECG, B, is used to rule out ME but is secondary. CT angiography, C, is diagnostic but not the priority. Heparin, D, is treatment but follows oxygen and diagnosis. Question 11. A patient with a dog bite to the hand presents 48 hours later with redness, swelling, and purulent discharge. What is the most likely causative organism? Option A, Staphylococcus aureus. Option B, Pasteurella multocida. Option C, Streptococcus pyogenes. Option D, Bichnella corrodens. The correct answer is option B, Pasteurella multocida. Pasteurella multocida is the most common organism isolated from dog and cat bite wounds. It typically causes infection that appears within 24-48 hours with purulent drainage. Staphylococcus aureus, A, and Streptococcus pyogenes, C, are also common but less specific to animal bites. Bichnella corrodens, D, is associated with human bites. Question 12. A patient is brought in with a nail gun injury to the chest. What is the priority nursing action? Option A, remove the nail. Option B, apply pressure to the wound. Option C, obtain a chest X-ray. Option D, assess for pneumothorax. The correct answer is option D, assess for pneumothorax. A nail gun injury to the chest can cause pneumothorax, hemothorax, or cardiac injury. The priority is to assess the airway and breathing. The nail should not be removed, A, as it may be tamponading a bleeding vessel. Pressure, B, may be applied but the priority is assessment. Chest X-ray, C, will help determine injury but follows assessment. Question 13. A 25-year-old female presents with acute onset of severe lower abdominal pain and vaginal bleeding. The patient states she is 8 weeks pregnant. What is the priority nursing action? Option A, administer 4 fluids. Option B, obtain a urine pregnancy test. Option C, prepare for immediate surgery. Option D, assess for signs of hypovolemic shock. The correct answer is option D. Assess for signs of hypovolemic shock. The patient's presentation of pain and bleeding in early pregnancy is concerning for ectopic pregnancy or spontaneous abortion. Hypovolemic shock can develop rapidly with intra- abdominal bleeding. Assessment of vital signs and signs of shock are the priority. For fluids, A, may be needed, but assessment comes first. A urine pregnancy test, B, is unnecessary, as the patient already knows she is pregnant. Surgery, C, may be needed but is not the first step. Question 14. A patient is brought in with a diagnosis of schizophrenia who is actively hallucinating. What is the best nursing approach? Option A, tell the patient the voices are not real. Option B, ask the patient what the voices are saying. Option C, ignore the patient's hallucinations. Option D, place the patient in restraints. The correct answer is option B. Ask the patient what the voices are saying. It is appropriate to ask the patient about the content of hallucinations in a non-judgmental manner. This helps assess for command hallucinations that may be dangerous. Telling the patient the voices are not real, A, denies their experience. Ignoring, C, is dismissive. Restraints, D, are unnecessary unless the patient is a danger. Question 15. A patient presents with severe right upper quadrant pain radiating to the right shoulder, nausea, and vomiting. The nurse anticipates a diagnosis of Option A, acute pancreatitis. Option B, acute cholecystitis. Option C, peptic ulcer disease. Option D, gastritis. The correct answer is option B, acute cholecystitis. The classic presentation of acute cholecystitis is severe right upper quadrant pain radiating to the right shoulder or back, Care's sign, along with nausea and vomiting. Acute pancreatitis, A, pain is epigastric and radiates to the back. Peptic ulcer disease, C, is epigastric pain. Gastritis, D, is epigastric burning or pain. Question 16. Which of the following is a contraindication to the use of continuous positive airway pressure, CPAP, in a patient with respiratory distress? Option A, COPD exacerbation. Option B, hypoxemia. Option C, confusion or inability to protect the airway. Option D, mild asthma exacerbation. The correct answer is option C, confusion or inability to protect the airway. CPAP requires a patient who can protect their own airway. A confused patient or one with an unprotected airway is at risk for aspiration and should not receive CPAP. COPD exacerbation, A, is an appropriate indication, as are hypoxemia, B, and asthma exacerbation, D, with caution. Question 17. A patient's ABG results show pH 7.25, PaCO 255 mmHg, HCO 24 milliequivalent/L. What is the most likely interpretation? Option A, metabolic acidosis. Option B, metabolic alkalosis. Option C, respiratory acidosis. Option D, respiratory alkalosis. The correct answer is option C, respiratory acidosis. The ABG shows a low pH, acidemia, elevated PaCO 2, greater than 45 mmHg, and normal HCO3. This is consistent with acute respiratory acidosis from hypoventilation. Metabolic acidosis, A, would show a low HCO3. Metabolic alkalosis, B, would show elevated pH and HCO3. Respiratory alkalosis, D, would show low PaCO 2. Question 18. A patient has presented to the ED with a complaint of chest pain. Which of the following represents an appropriate delegation of tasks to a nursing assistant? Option A, perform a 12-lead ECG. Option B, obtain vital signs. Option C, administer aspirin. Option D, assess the chest pain. The correct answer is option B, Obtain vital signs. Obtaining vital signs is within the scope of practice for a nursing assistant and is appropriate for delegation. Performing an ECG, A, may be delegated in some states but is often a nursing responsibility. Administering aspirin, C, is a medication and cannot be delegated to a nursing assistant. Assessment, D, cannot be delegated. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient with a history of alcohol use disorder presents with confusion, ataxia, and ophthalmoplegia. What is the most likely diagnosis? Option A, Wernicke-Korsakoff syndrome. Option B, delirium tremens. Option C, alcoholic ketoacidosis. Option D, hepatic encephalopathy. The correct answer is option A, Wernicke-Korsakoff syndrome. Wernicke-Korsakoff syndrome presents with the triad of confusion, ataxia, and ophthalmoplegia, caused by thiamine deficiency due to chronic alcohol use. Delirium tremens, B, presents with tremor, agitation, and hallucinations. Alcoholic ketoacidosis, C, presents with metabolic acidosis. Hepatic encephalopathy, D, presents with altered mental status due to liver failure. Question 20. A patient who has ingested a large amount of acetaminophen is at risk for? Option A, acute kidney injury. Option B, hepatic necrosis. Option C, pulmonary fibrosis. Option D, cardiomyopathy. The correct answer is option B, hepatic necrosis. Acetaminophen toxicity causes hepatic necrosis due to accumulation of the toxic metabolite NAPCI, which depletes glutathione and damages hepatocytes. Acute kidney injury, A, can also occur but is secondary. Pulmonary fibrosis, C, and cardiomyopathy, D, are not associated with acetaminophen toxicity. Question 21. A patient with acute pancreatitis has the following labs. Which finding is most concerning? Option A, elevated serum amylase. Option B, elevated serum lipase. Option C, elevated blood glucose. Option D, decreased serum calcium. The correct answer is option D, decreased serum calcium. Hypocalcemia in acute pancreatitis is a poor prognostic sign. It occurs due to saponification of calcium with fatty acids in necrotic fat tissue. Hypocalcemia can also indicate severe pancreatitis with significant necrosis. While elevated amylase, A, and lipase, B, are diagnostic, they do not indicate severity. Elevated glucose, C, is common but less concerning than hypocalcemia. Question 22. A patient presents with agitation, confusion, and is hyperthermic after ingesting a street drug. The patient's pupils are dilated, skin is dry, and the patient is tachycardic. What is the most likely drug involved? Option A, cocaine. Option B, methamphetamine. Option C, anticholinergic drug, example PCP. Option D, ecstasy. The correct answer is option C, anticholinergic drug, example PCP. The anticholinergic toxidrome is characterized by red as a beet, dry as a bone, hot as a hare, blind as a bat, mad as a hatter, flushed skin, dry skin, hyperthermia, mydriasis, dilated pupils, and delirium. Cocaine, A, and methamphetamine, B, cause tachycardia but also diaphoresis and constricted or dilated pupils depending on the stage. Ecstasy, D, can cause similar symptoms but typically also includes diaphoresis. Question 23. A patient is brought in with suspected carbon monoxide poisoning. What is the most important diagnostic finding? Option A, carboxyhemoglobin level. Option B, ABG with PAO2. Option C, methemoglobin level. Option D, white blood cell count. The correct answer is option A, carboxyhemoglobin level. Carboxyhemoglobin, COHB, level is diagnostic for carbon monoxide poisoning. ABG PAO2, B, may be normal despite severe hypoxia because co-binds to hemoglobin. Methemoglobin, C, is seen with other toxic exposures. WBC, D, is nonspecific. Question 24. A patient has a Glasgow Coma Scale, GCS, score of 7. What does this indicate? Option A. The patient is neurologically intact. Option B. The patient has a moderate brain injury. Option C. The patient has a severe brain injury. Option D. The patient is brain dead. The correct answer is option C. The patient has a severe brain injury. GCS scores are interpreted as 13-15 mild brain injury, 9-12 moderate brain injury, and 3-8 severe brain injury. A score of 7 indicates severe brain injury requiring intubation and ICU care. This patient is not intact, A, does not have moderate injury, B, and is not brain dead, D. Question 25. A patient is brought in after a sexual assault. Which of the following nursing actions is most appropriate when discussing the forensic exam? Option A. Explain the importance of the exam and offer to have a sexual assault nurse examiner, CEN, perform the exam. Option B. Tell the patient they must undergo the exam to report the assault. Option C. Perform the exam yourself to minimize the number of people involved. Option D. Delay the exam until law enforcement is present. The correct answer is option A. Explain the importance of the exam and offer to have a sexual assault nurse examiner, CEN, perform the exam. Patients who have been sexually assaulted should be informed about the forensic exam, offered the option of having a CEN nurse, specialized in sexual assault care, and given the choice to proceed. The exam should never be forced, B, and a CEN nurse should perform the exam if available, C. Law enforcement involvement, D, is the patient's choice.